For the immune system, I'm Yasser.
I'm Brenda.
I'm Josh.
I'm Tyler.
I'm Haley.
And I'm Jessie.
Think of how isolated this little girl feels from the rest of the world because of her lack of an immune system. Think of this little girl's emotions. She can't interact normally. She can't function normally. She can't live normally. Quality of life is derived from the abilities that humans have to do things. Without these abilities, life would be miserable and non-existent. On top of the quality of life that the immune system provides to humans, it also keeps people alive. No matter what the other body systems do to keep people alive, they would be defenseless against foreign invaders without an immune system. A body without an immune system is like a beautiful country with no army. It will fail.
The function of the immune system is to prevent pathogens from entering the body by filtering the air you breathe using physical and chemical barriers. The immune system works to protect your cells from foreign pathogens through filtration and prevention. The body does this by signaling macrophages and other white blood cells, such as T cells, to attack foreign and infected cells. Your immune system has the ability to recognize and kill abnormal cell growth, such as cancer cells that develop within the body.
Keeping the immune system healthy means eating healthy, which means eating fruits, vegetables, and whole grains. You can also keep your immune system healthy by managing your stress, getting at least 30 minutes of exercise a day, getting 7 hours of sleep a day, getting vaccinated, and avoiding alcohol and tobacco.
When your immune system gets unhealthy, that is because a deadly pathogen has come into your body and starts overtaking your white blood cells. To recover from a deadly infection, you just need to rest to give your body time to heal itself.
Crohn's disease is an autoimmune disease that affects the gastrointestinal tract. The cause of Crohn's is unknown, but it used to be thought that it could be caused from diet and stress, but now scientists are believing that it could be an autoimmune or hereditary disease. Some of the symptoms of Crohn's disease is diarrhea, fever, fatigue, abdominal pain, cramping, blood in stools, and more. Some of the treatments are colonoscopy, CT scan, and magnetic resonance imaging. There are about 25 to 200 Crohn's disease cases out of 100,000 people in a year. The majority of these cases are adults above 20 years old, and it occurs more frequently in females. About 70% of these patients will have surgery after their diagnosis within the first 10 years.
Another disease of the immune system is lupus. Lupus is an autoimmune disease that causes your immune cells to attack your healthy living cells. The cause of lupus is still unknown, but sunlight and/or other toxins could be a trigger. Some symptoms include trouble breathing, hair loss, inflammation, fatigue, dryness, chest and muscle pain, swelling, and the signature white butterfly right beneath the eyes. Currently, there is no cure for lupus, but you can reduce your symptoms by taking immunosuppressants, having a healthy diet, and reducing your sun exposure. The Lupus Foundation of America approximates about 1.5 million Americans suffer from lupus and about 5 million people worldwide. Lupus is most common in females and African Americans.
Leukemia is a cancerous disease of the blood in which the body produces a ton of white blood cells that are not going to be used to serve any purpose. The cause of leukemia is unknown, but there are a lot of risk factors that will make a person more likely to get leukemia. Some of the signs and symptoms of leukemia, at first they're not really apparent in a patient, but as time goes on and the disease develops, the patient will experience a lot of weakness, fatigue, chronic joint pain, and night sweats. Leukemia is initially diagnosed by a blood test showing elevated white blood cell counts, and then they will do a biopsy of the pelvis, in the bone marrow in the pelvis, to confirm the leukemia. Leukemia can be treated by radiation therapy, chemotherapy, stem cell transplant, or targeted therapy. And leukemia is a disease that 1.5% of men and women will be diagnosed with in their lifetime. And leukemia was the cause of 4.1 cancer-related deaths in the United States in 2017.
Hashimoto's disease is an autoimmune disorder in which antibodies directed against the thyroid gland lead to chronic inflammation. There is no known exact cause of Hashimoto's. However, there are several risk factors such as gender, heredity, hormones, excessive iodine intake, and exposure to radiation. The symptoms of Hashimoto's include hair loss, unexplained weight loss and weight gain, fatigue and sluggishness, and sensitivity to cold temperatures. To treat this disease, synthetic hormones are given to replace and regulate those hormones. Synthetic hormones are also given to relieve and reduce the symptoms of Hashimoto's. Hashimoto's is more common in women than it is in men. Approximately 3 to 5 out of 10,000 people will be affected with Hashimoto's. Alarmingly, 14 million people in the United States are affected with Hashimoto's.
Severe combined immunodeficiency disease is a genetic defect in your X chromosome, and it develops in your mother's womb when you're a fetus. SCID is a defect in your T and B cell production, and it can mean a simple cold can kill you. Symptoms include failure to fight off infection, hyperinflation of the chest, respiratory infections, and poor growth. Enzyme replacement therapy can also help the immune system functionally properly by putting in the missing ADA enzyme, but the most effective treatment is a bone marrow transplant, and that can be done to help increase the production of white blood cells by replacing the unhealthy bone marrow with new donated bone marrow. A bone marrow transplant has an 80% success rate. The later SCID is diagnosed, the more expensive the treatment can become. Children that have it will most likely not live past the age of 2, and this affects about 200,000 people in the United States.
Another immune system disorder is non-Hodgkin's lymphoma. This describes cancer in the body's vital lymph nodes as a result of malignant lymphocytes. The definite cause of non-Hodgkin's lymphoma is unknown. However, pesticides and other lawn care products have also been linked to non-Hodgkin's lymphoma. The most common sign and symptom is the enlargement of lymph nodes. Bloodstream-related issues such as too few red and white blood cells, as well as too few platelets, are another common sign. For treatment of lymphoma includes radiation therapy, chemotherapy, and a combination of both. Radiation therapy targets the affected area with radiation in treatment sessions that span about 5 weeks. Chemotherapy uses a drug or a combination of drugs injected intravenously once a month for 6 or so months to treat lymphoma. Non-Hodgkin's lymphoma is the most prevalent form of lymphoma. From the 80,000 cases of lymphoma, 71,000 are in the non-Hodgkin's form. Lymphoma kills about 20,000 people per year. 19,000 of these deaths are attributed to non-Hodgkin's lymphoma.
The immune system is composed of lymphatic tissue and lymphocytes that help keep the human body free from invading pathogens. Any type of defects in the body can result in severe life-threatening diseases in which you are put at severe risk. And because of our fantastic immune system, this little girl can be free from this vicious cell. Go, little girl. Be free. Be free. Be free and safe.